All right, so this time we're taking a deep dive into the world of skin, hair, and nails.
Oh, the integumentary system.
Yeah, exactly. It's amazing how much we take our skin for granted.
I know, right?
It's easy to forget that it's actually our largest organ.
And it's incredibly complex.
That's why we've got this stack of medical textbooks and nursing guides. Looks like
Yeah.
you really want to get into the nitty-gritty of the integumentary system this time.
Absolutely. The more details, the better.
Okay, well, let's start with the basics. The textbooks break down the skin structure into three main layers.
Right. The epidermis, dermis, and subcutaneous tissue.
Starting with the epidermis, the outermost layer, get this, it completely replaces itself every 35 to 45 days.
Yeah. It's constantly shedding and renewing itself.
So that's why our skin can heal from cuts and burns so effectively. It's like a self-healing shield,
Exactly. And underneath that, you've got the dermis.
which is where all the action happens.
Yeah, you've got blood vessels, nerves, hair follicles.
It's a busy place. And then there's that deeper layer, the subcutaneous tissue.
Mostly fat and connective tissue, right?
Yep. It helps anchor the skin to the muscles and bones underneath, like the foundation of it all.
It also acts as insulation, which helps regulate our body temperature.
So you've got this multi-layered marvel, but the books also highlight all these amazing functions that the skin performs. It's not just about protection.
Definitely not.
Yeah.
It's crucial for regulating body temperature, sensing our environment, and even producing vitamin D when exposed to sunlight.
So it's like this incredible sensory organ.
Absolutely.
The textbooks mention all these sensory and nerve endings, like mechanoreceptors that allow us to feel touch, thermoreceptors for temperature, and nociceptors that signal pain.
It's amazing how our skin is constantly collecting information about the world around us.
Like right now, I can feel the texture of this chair. That's thanks to those mechanoreceptors.
Exactly. And the concentration of these receptors varies across the body.
Oh, that's interesting.
Yet, think about your fingertips. They're incredibly sensitive to touch, allowing you to distinguish between all sorts of textures.
That makes sense. I've always wondered why my fingers are so much more sensitive than, say, my elbows.
It's all about those receptors.
Now, here's what I find really fascinating, and the books touch on this as well. The appearance of our skin, hair, and nails can actually offer clues about our overall health.
It's true.
It's like they're sending us secret messages.
Subtle changes in these areas can sometimes point to underlying health conditions.
Like, for example, those tiny splinter hemorrhages you sometimes see under the nails.
Those thin, reddish-brown lines.
Yeah, I always thought those were just from little injuries.
They can be, but sometimes they can indicate something more serious, like endocarditis,
Which is,
an infection of the heart valves.
wow, I had no idea those tiny lines could be so significant. The books also mention Bow's lines.
Those horizontal grooves across the nail.
Yep. What can those tell us?
They can sometimes indicate a past illness or even malnutrition. It's like a little timeline etched into the nail.
That's incredible. So it's like our bodies are leaving behind these subtle clues, and if we know how to read them, we can get a better understanding of our health. What about things like brittle nails, or that spooning shape where the nail dips in the center?
Brittle nails can be a sign of nutritional deficiencies or thyroid problems. And spooning, also known as cholinikia, is often associated with iron deficiency anemia.
So even seemingly minor nail changes can be red flags. I'm guessing doctors pay close attention to these details during checkups.
Absolutely. Nail assessments are a routine part of many medical examinations. It's a simple way to potentially pick up on underlying health issues.
Okay, so nails are like tiny billboards broadcasting our health status. What about hair? Can changes in hair texture or appearance signal anything about our overall well-being?
Absolutely. Hair texture and growth patterns can be affected by various factors, including nutritional deficiencies, hormonal imbalances, and even certain medications.
So if someone suddenly notices significant changes in their hair, it's definitely worth getting checked out by a doctor.
Exactly. It's always a good idea to consult with a healthcare professional if you notice any significant or persistent changes in your skin, hair, or nails.
Well, I'm already looking at my nails in a whole new light. Now let's shift gears a bit and talk about skin lesions. The textbooks do a deep dive into all the different types and what they might mean.
It can feel like learning a whole new language sometimes.
It really can. So let's start with some of the basics. What exactly is a papule?
A papule is a small, solid bump, like a mole or a pimple.
Okay, so papules are those raised bumps we see all the time.
Yeah.
Then there are nodules,
Which are?
larger, firmer bumps.
Exactly. And they often extend deeper into the skin.
The books mention warts as a classic example of nodules.
Right.
Okay, got it. Now, what about those fluid-filled bumps? The books mention vesicles and bullae.
A vesicle is a small, fluid-filled sac, like a chickenpox blister.
And bullae are?
Essentially larger versions of vesicles, like the blisters you might get from a burn.
Got it. And then there are those infamous pustules. I always think of them as tiny volcanoes of pus.
Good analogy. And you're right, pustules are those small bumps filled with pus, often seen with acne.
So we've got papules, nodules, vesicles, bullae, and pustules. What other types of lesions do we need to know about?
Well, there are wheals, which are raised, itchy bumps, often associated with allergic reactions like hives.
Hives. This can be so uncomfortable. The books also mention plaques, which are,
Larger raised areas of skin that are often scaly.
and those are commonly seen with psoriasis.
Yes, a chronic inflammatory condition.
And speaking of scaly, let's not forget about scales themselves, those dry, flaky patches of skin.
Which you might see with conditions like dandruff or eczema.
Right. So many different types of lesions. This is all super helpful in understanding those medical descriptions you see on skincare websites, or even when reading a doctor's note.
It's like having a cheat sheet for deciphering dermatological terminology.
Exactly. So, armed with our newfound knowledge of lesions, let's tackle some common skin conditions. The textbooks seem to emphasize dermatitis, particularly contact dermatitis.
It's incredibly common.
What is it exactly?
It's an inflammatory reaction triggered by contact with an irritant or allergen.
So it's like your skin saying, hey, I don't like this substance, get it off me.
Exactly. And the reaction can range from mild redness and itching to more severe blistering and pain.
The textbooks list all sorts of things that can trigger contact dermatitis, from soaps and detergents to cosmetics and even certain plants, like poison ivy. It's kind of alarming how many potential irritants we encounter every day.
It really is. And identifying and avoiding those triggers is key to managing contact dermatitis.
So if you're constantly battling itchy, irritated skin, it might be time to become a detective and figure out what's setting it off.
I like that. A little detective work can go a long way in managing skin conditions.
Speaking of detective work, let's talk about pressure injuries, also known as bed sores. The textbooks go into detail about these, emphasizing how serious they can be.
Yeah, they develop when there's prolonged pressure on the skin, which cuts off blood flow and leads to tissue damage.
And they're especially concerning for people with limited mobility, like those who are bedridden or wheelchair-bound.
Right.
The books mention the Breeden scale, which is a tool healthcare providers use to assess a person's risk of developing pressure injuries.
It takes into account factors like mobility, sensory perception, moisture.
Activity, nutrition, and friction and shear.
Exactly.
So it's a comprehensive assessment to identify those who might need extra care and preventative measures. The textbooks also break down the stages of pressure injuries,
It starts with stage 1, which is marked by redness that doesn't blanch.
meaning it doesn't turn white when you press on it.
Right.
Then you have stage 2, where there's partial thickness skin loss, often presenting as a blister or abrasion.
And it gets progressively worse from there.
Stage 3 involves full thickness skin loss, creating a shallow crater that can sometimes have drainage,
And stage 4 is the most severe.
where the ulceration extends so deeply that it can expose muscle and bone.
Exactly.
That's a really stark reminder of how important it is to prevent pressure injuries from developing in the first place.
Absolutely. Early detection and intervention are crucial. Now that we've covered some of the more serious aspects of skin health, let's dive into some of the most common skin conditions you might encounter.
Sounds good. Where should we start?
Well, how about dermatitis? We've already talked about contact dermatitis, but there are other types that are worth mentioning.
Okay, so beyond the irritants and allergens, what other kinds of dermatitis are out there?
There's atopic dermatitis, more commonly known as eczema. It's a chronic condition that often starts in childhood.
Eczema, I've heard of that. What are the symptoms?
It's characterized by dry, itchy skin.
Eczema is a tough one because it's not always clear what triggers those flare-ups.
The textbooks mention a combination of genetic and environmental factors.
Right, so it can be a complex interplay of things. And is there a cure for eczema?
Unfortunately, no. But there are treatments that can help manage the symptoms.
Like what?
Things like moisturizers, topical corticosteroids to reduce inflammation.
And antihistamines to help with the itching.
Exactly. And avoiding triggers can also play a big role in managing eczema.
Like certain fabrics or soaps.
Yes, and even stress can be a trigger for some people.
It sounds like a lot of trial and error to figure out what works best for each individual.
It can be, but the good news is that there are many options available. Now, ready? The textbooks describe it as a combination of clogged pores, excess oil production, and bacterial overgrowth.
So it was like a perfect storm of skin issues. And while it's most common during adolescence,
Acne can persist into adulthood.
tell me about it.
The textbooks mention a wide range of treatment options,
Okay, like what?
from gentle cleansing and topical medications to oral antibiotics and even Accutane in severe cases.
Accutane. That sounds pretty intense. I know it has some serious potential side effects.
You're right, Accutane can be very effective for severe acne, but it can also cause side effects like dry skin, mood changes, and even birth defects.
So definitely a medication that requires careful consideration and monitoring.
Absolutely.
The textbooks also stress the importance of avoiding picking at acne lesions, as this can lead to scarring.
And keeping your face clean and avoiding harsh scrubs can also help.
Okay, good advice. Now, what about rosacea? It's another condition that often shows up on the face.
Rosacea is a chronic condition that causes redness, flushing, sometimes small, pus-filled bumps on the face. It's often mistaken for acne, but it's a different beast altogether.
So how do you tell them apart?
Rosacea typically involves more persistent redness, visible blood vessels, and often a lack of blackheads or whiteheads, which are hallmark signs of acne.
Interesting. So if you're dealing with redness and flushing, it's worth getting it checked out to determine if it's rosacea or something else.
Exactly. And once it's diagnosed, there are treatments that can help manage the symptoms.
What kind of treatments?
Things like sun protection, avoiding triggers like certain foods or beverages, and even medications like oral antibiotics or topical creams to reduce redness and inflammation.
Now, are you ready to delve into the world of infections?
Haha, bring it on. This is where things start to get really interesting. Or maybe a little gross, depending on your perspective.
Let's start with one that's highly contagious, especially among kids impetigo.
Oh yeah, impetigo.
It's that bacterial infection that causes those honey-colored crusts on the skin.
Exactly. And it spreads through direct contact with the sores or by touching contaminated objects.
So hand washing is key to preventing the spread. What about treatment?
The textbooks mention that antibiotics, either topical or oral, are usually effective in treating impetigo.
Okay, good to know. What about cellulitis? That sounds a lot scarier.
Cellulitis is a deeper bacterial skin infection that can spread rapidly. It usually causes redness, warmth, swelling, and pain in the affected area.
So unlike impetigo, which is mostly a superficial infection, cellulitis involves those deeper layers of the skin.
Right, and because it can spread quickly, it often requires oral or even intravenous antibiotics to get it under control.
So if you suspect cellulitis, it's definitely not something to mess around with. It's important to see a doctor right away.
Absolutely. Now let's talk about something a little less intimidating, warts.
Warts, those little bumps caused by the human papillomavirus, or HPV. They're not usually dangerous, but they can be quite annoying.
That's right. And while they're more common in children, adults can get them too.
I remember getting warts on my hands as a kid. I tried all sorts of home remedies, but I think they eventually just went away on their own.
That's often the case. But for those who are bothered by warts, there are various treatment options available.
The textbooks mention topical medications, cryotherapy, which involves freezing the wart, and even surgical removal in some cases.
Right.
Now, let's move on to an infection that's often associated with childhood, but adults can get it too. Hand-foot-mouth disease.
Hand-foot-mouth disease.
Yeah, it's caused by a virus and typically causes fever, mouth sores, and a rash on the hands and feet.
It's highly contagious and spreads through contact with saliva, blister fluid, or feces.
So good hygiene and frequent hand washing are crucial for preventing the spread, especially in settings like daycare centers and schools.
Absolutely. Now, let's talk about an infection that's often misconstrued as being related to poor hygiene: scabies.
Scabies, just a word makes me itch. It's caused by tiny mites that burrow into the skin, causing intense itching.
And it's important to emphasize that scabies isn't about cleanliness. Anyone can get it through close contact with an infected person or even contact with contaminated bedding or clothing.
The textbooks highlight the importance of treating not only the infected person, but also their close contacts and their environment to prevent reinfestation.
Exactly. And the treatment usually involves a topical medication called a scabicide, which kills the mites.
Okay, moving on to another category of infections, the tinea infections.
Those pesky fungal infections that can pop up in various places on the body.
We're talking ringworm, athlete's foot, and jock itch, all caused by different types of fungi.
But they all thrive in warm, moist environments.
So keeping things clean and dry is key to preventing them. The textbooks also mention avoiding sharing personal items like towels or clothing.
And if you do get a tinea infection, antifungal medications, either topical or oral, are usually effective in clearing it up.
Okay, good to know. Now let's move on to a condition that can be quite painful and debilitating, herpes zoster, commonly known as shingles.
Shingles is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox.
So anyone who's had chickenpox is at risk of developing shingles later in life.
Exactly. It can lie dormant in nerve cells for years and then reactivate, causing a painful rash.
And the rash usually
Follows a nerve pathway,
The textbooks mention that it often appears as a band of blisters on one side of the body.
and it can be accompanied by pain, itching, and even flu-like symptoms.
So, not a fun experience at all. Are there any treatments for shingles?
Yes, antiviral medications can help shorten the duration of the outbreak and reduce the severity of symptoms. There's also a vaccine available that can significantly reduce the risk of developing shingles.
Good to know there are preventative measures available. The textbooks also mention herpes simplex, another viral infection that can cause skin lesions.
Right, herpes simplex virus type 1 typically causes cold sores around the mouth.
And type 2.
Is associated with genital lesions.
And both types can cause painful blisters and ulcers.
And while there's no cure for herpes, antiviral medications can help manage outbreaks and reduce their frequency and severity.
Okay, well, we've covered a lot of ground here, from basic skin anatomy to a whole array of skin conditions.
It's amazing how much diversity there is when it comes to skin health and disease.
It really is. And we've only just scratched the surface. We'll be back with part 2 of this deep dive into the integumentary system to explore even more fascinating aspects of this incredible organ.
Welcome back to our deep dive into the integumentary system. In part 1, we focus mainly on adult skin,
Right.
but we haven't forgotten about the little ones.
Ah, yes, kids.
Yeah, you've given us some great sources that focus specifically on skin issues in children.
Children's skin is still developing, so it makes it more vulnerable to certain conditions.
And let's be real, kids get into everything.
Oh, I know. Always exploring, touching things.
It's a recipe for skin problems.
It is.
So let's start with something that I think a lot of parents encounter. Cradle cap.
Cradle cap.
Yeah.
It's incredibly common. What is that exactly?
It causes those yellowish, greasy, scaly patches on a baby's scalp.
I remember those. They can look kind of alarming at first.
But it's usually harmless.
The books say it doesn't even seem to bother the baby.
No, not at all. It's thought to be related to overactive oil glands.
And it usually clears up on its own.
Within a few months, yeah.
That's good to know. The textbooks recommend gently washing the baby's scalp with, a soft brush.
And baby oil can help loosen the scales.
So just to reassure parents, cradle cap isn't contagious.
No, it's not. And it doesn't usually itch or cause any discomfort.
Now, what about prickly heat? Isn't that what causes those tiny little bumps you sometimes see on a baby's skin when it gets too hot?
Prickly heat.
Yep.
Yeah, it's common rash that develops when sweat glands get blocked and then the sweat gets trapped under the skin.
So it's those small red bumps.
Yeah, usually on areas where sweat tends to collect, like the neck, folds of the skin, the diaper area.
The sources really emphasize the importance of preventing prickly heat.
Oh, absolutely.
How do you do that?
You want to dress babies in loose-fitting, breathable clothing and avoid overheating. Keep them cool and dry. Cool baths can help. Air conditioning.
Makes sense. Speaking of keeping babies dry, let's move on to another really common and often frustrating condition, diaper rash.
Diaper rash. Just an irritation of the skin in the diaper area, usually caused by prolonged contact with urine and feces.
Anyone who has ever changed a diaper knows how uncomfortable it can make a baby.
Absolutely. So important to do frequent diaper changes. Gentle cleansing with water and a soft cloth.
The books actually caution against using harsh soaps or wipes with fragrances or powders.
Right, because those can irritate the skin further.
Yeah.
The goal is to keep that area as clean, dry, and free of irritants as possible.
Now, the textbooks also mention candidiasis in the context of diaper rash.
Candidiasis. It's a fungal infection caused by Candida albicans.
So that's the same fungus that causes thrush.
Exactly. Those white patches in a baby's mouth.
And when it affects the diaper area,
Often causes a bright red rash.
So the sources emphasize the importance of good hygiene, particularly for bottle-feeding babies.
To help prevent the spread of Candida,
And if a yeast infection is suspected,
antifungal cream might be necessary to clear it up.
so we've covered some of the common irritations, fungal infections. What about bacterial infections? The textbooks mention staphylococcal infections as being quite common in children.
Staph infections, especially those caused by Staphylococcus aureus, can cause a range of skin problems.
Like what kind of problems?
From minor pimples and boils to more serious infections They often present as red, swollen, painful bumps.
And they can sometimes ooze pus.
Yeah. Hand washing is so crucial for preventing the spread of staph infections.
The textbooks also highlight this growing concern of MRSA.
Methicillin-resistant Staphylococcus aureus.
What is that exactly?
It's a type of staph bacteria that's become resistant to many common antibiotics.
Oh, wow.
Makes it much more difficult to treat.
So if a child develops a staph infection, does that mean it's automatically MRSA?
Not necessarily. Most staph infections are still susceptible to common antibiotics, but it's definitely something that doctors are more aware of these days. And they might order a culture.
The culture.
Yeah, to determine the best antibiotic to use.
So it's a test to see which antibiotic will be most effective against the specific bacteria causing the infection.
Exactly.
Okay, so you've got hand washing, keeping an eye out for infections, following a doctor's advice. Those are key takeaways here. Now, we talked about impetigo earlier when we were discussing adult skin conditions, but I think it's worth revisiting because...
So common in children.
Exactly.
And it's highly contagious, spreads quickly through direct contact.
How does it usually start?
It often starts as small blisters that rupture, and then they form those honey-colored crusts.
And it can spread to other parts of the body or even to other people.
Through contact with the sores or contaminated objects.
So if one child in a family gets it,
It can spread like wildfire.
what should you do to prevent that?
Keep those infected areas covered. Encourage frequent hand washing. And avoid scratching, because that can spread the bacteria.
The textbooks say that antibiotics, either topical or oral, are usually effective in treating impetigo.
Yeah, usually.
Now, hand-foot-mouth disease, that's another one that's highly contagious, especially in kids, right?
Yes, especially in those group settings like daycare centers and schools.
What causes that?
A virus typically causes fever, mouth sores, and a rash on the hands and feet.
Is there any treatment for that?
It's usually mild and self-limiting, so it runs its course without needing specific treatment.
Oh, okay. But it can still be pretty uncomfortable, I imagine.
It can, especially those mouth sores. So it's important to keep the child hydrated, offer soft foods that are easy to swallow, and of course, because it's so contagious, it's important to keep them home from school or daycare.
Until they're no longer contagious.
Right, to prevent spreading it to others.
Now, I want to shift gears a little bit to talk about burns, which...
A leading cause of accidental injury and death in children.
And, as the sources point out, almost all childhood burns are preventable.
It's true. Children are so curious, and they often don't understand the danger.
It's heartbreaking to think about.
It is. So we need to be extra vigilant when it comes to burn prevention.
What kind of advice do the books offer?
Keep hot objects and liquids out of reach of children. Install smoke detectors and carbon monoxide detectors. Teach children about fire safety.
And if a burn does occur, knowing what to do in those first few minutes can make a huge difference. What should you do?
First step is to stop the burning process. If clothing's on fire, stop, drop, and roll is still the best advice. For burns caused by hot liquids or objects, immediately remove that heat source.
Then,
Cool the burn with cool running water for 10 to 20 minutes.
don't use ice, right?
No, never ice. It can further damage the skin.
After cooling the burn, cover it with a clean, dry dressing. And the sources really stress the importance of seeking medical attention for any burn.
That's larger than a small superficial burn.
Or if there are any signs of infection.
And for severe burns,
Call 911 immediately. The textbooks also go into detail about how to assess the severity of burns. They mention this rule of nines, which I have always found a little confusing. Can you break that down for our listeners?
rule of nines.
Yeah.
It's a quick way for healthcare providers to estimate the percentage of body surface area that's been burned. It divides the body into sections, each representing approximately 9% of the total body surface area.
So the entire head is 9%.
The entire head is 9%, each arm is 9%, the front of the torso is 18%, the back of the torso is 18%, each leg is 18%, and the genitals represent 1%.
Okay, so by adding up the percentages of the burned areas,
Healthcare providers can get a rough estimate of the burn's extent
and that helps them determine the severity of the burn.
and guide treatment decisions.
So it's just a quick mental math calculation. The sources also talk about these different zones of a burn injury. They have all these fancy names.
Yeah, the zone of coagulation, the zone of stasis, the zone of hyperemia.
Okay, so the zone of coagulation.
That's where the tissue damage is most severe.
The zone of stasis is where the blood flow is compromised.
And the zone of hyperemia.
There's minimal damage there. It's like a bullseye.
Yeah, with varying degrees of impact.
That's a great analogy. This whole concept of the zones.
It helps guide treatment.
and predict the potential for healing. There's also something called the Parkland formula.
The Parkland formula, that one sounds really technical.
It is. It's a calculation used to determine the amount of fluid resuscitation a burn patient needs in the first 24 hours after the injury. So it takes into account the patient's weight and the percentage of body surface area burned
It's a way to make sure they're getting enough fluids.
to compensate for the fluid loss that occurs with burns.
Exactly. Fluid resuscitation is crucial for maintaining blood pressure and preventing complications like shock.
The textbooks also mention the open and closed methods for burn wound management.
The open method involves exposing the burn to air,
And the closed method.
uses dressings.
And I'm guessing the closed method is generally preferred?
Yes, in most cases, the closed method is preferred.
Why is that?
Dressings help to keep the wound clean, moist, and protected from further injury. They can also help reduce pain and promote healing.
They also talk about skin grafting,
For severe burns,
which involves
taking healthy skin from another part of the patient's body or from a donor and using it to cover the burn wound.
That's incredible how the body can do that.
It is amazing. The sources also emphasize the importance of nutrition.
For burn patients.
Yes, they need extra calories and protein to fuel that healing process.
Right, because their body is working overtime. Now let's talk about sunburns, which are basically radiation burns.
Caused by overexposure to ultraviolet radiation from the sun.
Incredibly common, especially during the summer months,
But you can get sunburned year-round,
even on cloudy days.
even on cloudy days. The sources really emphasize the importance of sun protection.
So we're talking wearing protective clothing.
Seeking shade during peak sun hours, using sunscreen with an SPF of 30 or higher.
And for babies under 6 months of age,
Best protection is to keep them out of direct sunlight altogether.
their skin is just too sensitive. And what about when choosing a sunscreen?
The sources recommend mineral sunscreens, especially for children.
Why is that?
They're less likely to irritate sensitive skin.
So zinc oxide and titanium dioxide.
Those are the active ingredients in mineral sunscreens.
How do they work?
They work by physically blocking UV rays from reaching the skin.
Okay, good to know. Now, I want to talk about something that's become increasingly popular in recent years. Body art.
Tattoos and piercings.
Yep.
It's important to remember that they involve breaking the skin's barrier, which increases the risk of infection.
So it's crucial to choose a reputable artist or piercer. Make sure they're following strict hygiene practices.
Absolutely. Do your research. Make sure the studio is clean, the artist is licensed and experienced,
And using sterile equipment.
of course.
And then once you've got your new tattoo or piercing,
Proper aftercare is so important.
to prevent infection.
Yes.
So what kind of advice do they give for aftercare?
Keep the area clean and dry. Avoid picking or scratching. Watch for signs of infection.
And what are some of those signs?
Redness, swelling, pain, or discharge. If you notice any of those.
See a doctor right away.
Right.
The sources also mention some of the other potential risks of tattooing and piercing beyond just the risk of infection.
Things like allergic reactions to inks or metals,
And keloid formation.
which is an overgrowth of scar tissue.
And of course, the transmission of bloodborne diseases if sterile techniques aren't followed.
Right.
And I guess it's also important to remember that tattoo removal.
Can be a lengthy and often costly process.
So it's not a decision to be taken lightly. Think carefully before getting a tattoo or piercing, and make sure you choose a design and location that you'll be happy with for the long term.
Absolutely.
Now, I want to shift gears a little bit and talk about some hair and nail disorders that can affect children and adults.
Sounds good.
So, the textbooks start with seborrhea, seborrheic dermatitis, and dandruff.
All conditions that involve an overproduction of oil from the sebaceous glands,
So, seborrhea affects the scalp.
causing oily hair and scalp.
Seborrheic dermatitis.
Can affect other areas of the body, causes those red, scaly patches.
And dandruff is like a milder form of seborrheic dermatitis.
That's limited to the scalp.
So it's kind of like a spectrum.
It is.
And are there treatments for those?
There are. The sources mention various treatments, things like medicated shampoos, topical corticosteroids, antifungal medications.
Now let's talk about hair loss or alopecia, which can be pretty distressing for people.
It can be. And it can be caused by a variety of factors.
Like what?
Genetics, hormonal changes, medical conditions, even certain medications can cause hair loss.
The textbooks discuss different types of alopecia. We've got androgenetic alopecia, which is the most common type.
Often referred to as male or female pattern baldness,
And then there's alopecia areata.
an autoimmune condition that causes patchy hair loss,
And then telogen effluvium.
which is a type of hair loss that's often triggered by stress or illness.
So is hair loss always permanent?
Not necessarily. Sometimes it can be temporary, reversible.
So telogen effluvium, for instance.
Often resolves on its own once the underlying trigger is addressed.
What about treatments for alopecia?
There are medications, hair transplantation surgery.
Even wigs or hair pieces.
Exactly.
Now, I know this is a common one, especially in kids. Pediculosis, better known as.
Head lice.
Just the word makes my scalp itch.
I know, right?
They're tiny insects that live on the scalp and feed on human blood, and they spread easily through close contact.
Very contagious.
What can you do to prevent it?
The textbooks emphasize regular head checks, especially for children in those school or daycare settings.
And if you find head lice,
Don't panic. There are effective treatments available.
like what?
Over-the-counter and prescription medications that kill the lice and their eggs.
And I guess fine-toothed combs can help to remove the nits.
The nits or the lice eggs.
And you have to treat everyone in the household.
Everybody's got to get treated.
Now let's move on to some nail disorders. Onychomycosis.
A fungal infection that affects the nails.
What does that look like?
Often presents as thickened, discolored, brittle nails. It can be quite stubborn.
So what kind of treatment?
Often requires prolonged antifungal therapy.
What can you do to prevent it?
Keep the nails clean and dry. Avoid trauma to the nails.
Okay. And onychocryptosis or ingrown toenails.
Ingrown toenails. A common and often painful condition. The edge of the toenail grows into the surrounding skin.
What causes that?
Can be caused by various factors. Improperly trimmed nails, tight shoes. Fungal infections can also contribute to ingrown toenails.
And are there treatments?
There are warm soaks, topical antibiotics, and in some cases, surgical removal of a portion of the nail might be necessary.
So proper nail care is important.
Absolutely. Trimming the nails straight across, avoiding cutting them too short.
Now, before we wrap up this section, I want to touch on a couple of acute conditions that can affect the skin. Urticaria and angioedema. Urticaria is also known as...
Hives.
What are hives exactly?
They're itchy, raised welts that appear on the skin, often triggered by an allergic reaction. Could be something like food, medication, insect stings,
They usually go away on their own, right?
usually within 24 hours.
And angioedema is similar to urticaria.
Similar, but it involves deeper layers of the skin.
And what kind of symptoms does it cause?
Swelling of the face, lips, tongue, and even the throat.
That sounds a lot more serious.
It can be. Especially the swelling affects the throat and interferes with breathing. If that happens, it's important to seek immediate medical attention.
So angioedema can actually be life-threatening in some cases.
It can be, yes.
The textbooks also discuss treatments for urticaria and angioedema.
Things like antihistamines, corticosteroids to reduce inflammation and itching.
And for severe cases of angioedema.
Epinephrine might be necessary to quickly reduce the swelling.
Now, I just want to quickly mention one more condition. Vitiligo. What is that exactly?
It causes a loss of pigmentation in patches of skin.
So it's like those white patches you sometimes see on people's skin.
Exactly. The exact cause is unknown, but it's thought to be an autoimmune disorder.
So the body's immune system is attacking the pigment-producing cells in the skin.
That's the idea.
And is there a cure for that?
There's no cure, but treatments are available.
To help repigment the skin.
Or even out skin tone.
The textbooks also talk about the importance of emotional support for people with vitiligo.
It's true, it can have a big impact on self-esteem.
Because our society places so much emphasis on physical appearance. Now let's shift gears and talk about the medications that are commonly used to treat some of these skin conditions.
Okay, let's do it.
So the textbooks cover a wide range of medications, everything from topical creams and ointments to oral and injectable drugs. It's amazing how many different medications are available. Let's start with corticosteroids.
Corticosteroids. They're powerful anti-inflammatory agents. They're used to treat a wide range of skin conditions, and they come in various forms.
Like what?
Topical creams, ointments, lotions.
Solutions, foams, even injections.
That's right.
So the textbooks go into detail about all the uses, actions, side effects, and nursing considerations for both topical and systemic corticosteroids.
With topical corticosteroids, it's important to use them sparingly and for short durations.
Why is that?
To minimize the risk of side effects like skin thinning and stretch marks.
And oral or injectable corticosteroids.
Those can have more serious side effects, especially with long-term use.
What kind of side effects?
Things like suppression of the immune system, weight gain, mood changes.
So it's important to weigh the benefits and risks carefully. Now let's move on to antibiotics, which of course are essential for treating bacterial skin infections. The books discuss some of the most common antibiotics prescribed for skin infections. We've got tetracycline, doxycycline, cephalexin.
Trimethoprim, sulfamethoxazole, clindamycin.
They go into detail about each antibiotic, the mechanism of action, potential side effects.
And they stress the importance of completing the full course of antibiotics,
Even if your symptoms improve.
even if your symptoms improve, to ensure that the infection is completely eradicated and to prevent antibiotic resistance.
Okay, so don't stop taking those antibiotics just because you're feeling better. Now let's talk about antiviral medications. Those are used to treat viral skin infections.
Like Hopi simplex.
And herpes zoster.
Right. The textbooks focus on acyclovir.
Acyclovir.
It's a commonly prescribed antiviral medication.
Mm.
It works by interfering with the replication of the virus.
And how is it administered?
Can be administered topically, orally, or even intravenously. It just depends on the severity of the infection.
And what does it do?
It can help shorten the duration of outbreaks and reduce the severity of symptoms.
Now, the sources mention Accutane or isotretinoin.
A potent oral medication used to treat severe acne that hasn't responded to other treatments.
And it has some serious potential side effects.
It does. Birth defects, depression, liver damage.
Wow.
So it's definitely reserved for severe cases.
And it requires careful monitoring by a dermatologist
Absolutely.
and women of childbearing potential.
Must use 2 forms of effective contraception while taking Accutane and for 1 month after stopping the medication.
Okay. Now let's discuss biologics. They're a newer class of medications that are used to treat certain skin conditions.
Like psoriasis and eczema.
Right.
Biologics. They're genetically engineered proteins that target specific components of the immune system.
And what do they do?
They help reduce inflammation.
They've really revolutionized the treatment of many chronic inflammatory conditions.
They have.
The sources focus on Humira or adalimumab as an example of a biologic that's used to treat moderate to severe plaque psoriasis and other inflammatory conditions.
Humira works by blocking tumor necrosis factor alpha,
Hmm.
also known as TNF-alpha. It's a protein that's involved in inflammation.
And while it can be very effective,
It's important to be aware of those potential side effects.
like what?
Injection site reactions, infections, and there's some rare but serious allergic reactions.
So careful monitoring and patient education are key.
Absolutely.
Now let's move on to antifungal medications, which are used to treat fungal skin infections. Tinea infections?
Onychomycosis.
The sources discuss several commonly prescribed antifungals, including fluconazole, itraconazole,
It's Rabinafoo.
and those come in a variety of forms.
Creams, ointments, shampoos, oral tablets, even intravenous formulations. It really just depends on the type and severity of the infection.
And what about potential side effects?
Can range from mild gastrointestinal upset to more serious liver problems.
So it's important to monitor liver function tests.
In patients taking certain antifungals, yes.
Now, to wrap up our discussion of medications,
Mhm.
antihistamines, which are used to treat allergic reactions, urticaria.
Angioedema.
Antihistamines work by blocking the effects of histamine,
A chemical that's released by the body during an allergic reaction.
and they come in both oral and topical forms. The sources mention diphenhydramine, which is more commonly known as Benadryl, and hydroxyzine, also known as Atarax.
Those are both commonly used antihistamines.
And they can be really effective in reducing that itching, swelling, and redness associated with allergic reactions.
They can be. But, it's important to be aware of those potential side effects.
Like what?
Drowsiness, dry mouth, blurred vision.
Especially with diphenhydramine.
Yeah, that one can cause significant drowsiness.
Okay, so use caution when driving or operating machinery after taking that. Finally, let's touch on permethrin.
A topical medication used to treat scabies and head lice.
It kills those scabies, mites, and head lice.
It does.
And it's available over the counter.
And by prescription.
The sources stress the importance of following the instructions very carefully when applying permethrin,
To make sure it's effective.
and to minimize those side effects like,
Mild skin irritation and itching.
well, I think we've covered a really wide range of medications. Everything from corticosteroids and antibiotics to antifungals, antivirals, even insecticides.
It's amazing.
It's amazing how many different tools are available to address skin problems.
It's a testament to the ongoing research in dermatology.
So as our understanding of skin health and disease continues to grow,
So too will our arsenal of treatments.
it's exciting to think about what the future holds.
Speaking of the future, we still have more to explore. We'll be back with part 3 of this deep dive into the integumentary system. We've got some final thoughts and takeaways for you.
And we're back for the final part of our deep dive into the integumentary system.
Whew, we've covered a lot of ground.
I know, right? From the structure of the skin and all these different conditions and treatments. But before we wrap up,
Yeah,
Was thinking about something, we've talked a lot about the medical aspects of skin, hair, and nails,
right.
but there's also a social and cultural dimension to consider.
That's a really good point. I mean, our society places a lot of emphasis on physical appearance,
It does.
and skin is often seen as a marker of beauty, health, youthfulness,
It is.
and that can lead to all sorts of pressures and insecurities.
Especially in a world where we're constantly bombarded with images of airbrushed perfection.
Exactly. It's easy to get caught up in comparing ourselves to others.
And feeling inadequate if our skin doesn't measure up to those unrealistic standards.
It's so important to remember that everyone's skin is unique. And, what's considered beautiful,
Yeah.
it varies widely across cultures and throughout history. Just think about it. Beauty standards have changed so much over time.
That's true. What was considered attractive in the Victorian era is completely different from what's considered attractive today.
Right. And even today, beauty standards differ significantly from one culture to another
So the key takeaway here is that beauty is subjective.
and constantly evolving.
And it's definitely not limited to what we see on the surface.
True beauty comes from within.
Absolutely.
Our character, our kindness, our compassion.
So how can we apply this to our own lives? To our relationship with our skin?
I think it starts with self-acceptance
Embracing our own unique features.
and imperfections.
Celebrating the skin we're in.
It's about shifting our focus from external validation to internal appreciation. Taking care of our skin from a place of self-love.
Rather than self-criticism. That's a really powerful message.
It is,
It's about treating our skin with respect and kindness.
regardless of how it measures up to those societal standards.
And recognizing that our skin is just one part of who we are. It doesn't define us.
It doesn't.
So as we wrap up this deep dive into the integumentary system, what are some key takeaways for our listeners?
Well, first and foremost, I hope you've gained a new appreciation for this incredible organ.
Your skin, it's more than just a pretty face.
It's vital to your overall health, your first line of defense against infection.
It helps regulate your body temperature. It allows you to sense the world around you. It even produces vitamin D.
And the appearance of your skin, hair, and nails.
Yeah,
It can offer valuable clues about your internal health.
it's like they're talking to you.
They are. So pay attention to those subtle changes.
And if you notice anything unusual,
Don't hesitate to see a doctor.
now that raises an interesting question. What changes will you make to your daily routine to better protect your skin?
Will you be more diligent about sun protection?
Will you make adjustments to your skincare routine?
Will you pay more attention to potential irritants or allergens?
And most importantly, will you embrace and celebrate the uniqueness of your own skin?
It's your skin. Own it.
We encourage you to keep learning about this topic. And of course, if you have any concerns,
Talk to your doctor.
thanks for joining us on this deep dive into the world of the integumentary system. We hope you learned some new things, and we hope you feel empowered to take better care of your skin.
Until next time, stay curious, stay informed, and stay healthy.
And remember, your skin tells your story. Embrace it.